Hello, Dr. Robert Lelouch, board-certified OB/GYN physician with over 30 years of clinical experience. Today we're going to talk about joint pain during pregnancy. It's pretty common to have all kinds of different sensations and discomfort during pregnancy, and joints aching and bothering you are one of those that happens early on. So in fact, you might even notice that before you know you're pregnant. So a little bit more aches and pains in the joints. Part of that is related to a hormone called relaxin that makes your ligaments and tendons a little bit looser. Perhaps it is there to help get your baby to come through your pelvis, but it does make your frame a little less stable, making your muscles work a little harder, makes you a little bit more likely to fall, to get an injury, so be careful about that. And also it's helpful to use some stretching exercises. One of the medicines that we use for joint pains you want to stay away from during pregnancy, that's called NSAIDs, non-steroidal anti-inflammatory drugs like Advil, Aleve, ibuprofen, Motrin, things like that, unfortunately. So stretching exercises are helpful. Some mild weights can help strengthen your muscles and keep you in good condition. It's pretty common also for it to get worse, especially if as your weight goes up, that adds more work to your frame. Later in pregnancy, you might even hear some popping and some hip sounds. You might even hear a clunking sound and have to wiggle funny to get your legs to move right and to get out of bed. That can be normal. You might also know some numbness and tingling in your hand and difficulty moving your hands in the last trimester of pregnancy, especially if you have a job where you use your hands a lot, like you're typing a lot or on a keyboard or a lot or doing repetitive things. That can be something called carpal tunnel syndrome. So you have a ligament that goes across here that helps with the movement of your hand, but it doesn't stretch as much, and with some swelling that can come, it can cause some of that numbness and tingling. They have some wrist braces that you can get at your pharmacy that help put your hands up in a more relaxed position when you sleep and can help resolve that. And you might have to diminish the use of your hands later on in pregnancy. It's something worth mentioning to your provider if you notice that. And also avoiding salty things can help with that, since it's related to swelling. So pizza, Doritos, pretzels, Chinese food, things like that can help out. So joint discomfort is common in pregnancy. It's not fun. However, with little changes in your diet, stretching exercise, and modifications, you can make it a little less of a problem. You can use some of the topical medicines, like some topical heat if you think you're going to go on a walk or move it around, and some topical cold if it's a little swollen and sore and you're ready to settle down and not move. We would appreciate you could use those. So I hope you found this video helpful. Please leave your comments. Thank you.